I'm a consultant for the Reproductive Health Access Project.
What made you want to become a preceptor and take on students within your department?
I think students always bring a lot to any kind of project. The students I've worked with have jumped right in, been very engaged, and of course, look beyond what I can see many times. They have much more experience with contemporary social media issues and bring a completely different perspective than mine.
What do you think about interns and how they impact the agency?
I think interns bring a lot in terms of the consumer audience that we're trying to interact with. Interns have very current knowledge of the topics that we're addressing. Interns are very engaged with approaching the public about issues of public health, and I really value their perspective.
How have interns made a difference in your department or your work?
The interns I worked with as we initiated the Reproductive Health Access Project were really terrific in terms of their fund of knowledge related to things like use of the web, use of social media, but also their previous experience in reproductive health projects. My experience is very academic. I've worked a lot in clinical situations, but the interns were users, if you will. They were the constituents that we were reaching out to, and so their perspective was very, very valuable.
What advice would you give students for the future who are interested in following a career path with the Department of Health?
I think that it's an opportunity to actualize and put into practice much of what you learn in your academic experience, that you get to see how to transform public policy, public health matters in a way that really can make a difference. And I think that is something that you don't actually experience when you're in school in the classroom. It's really an internship, which lets you see the real life impact of what you've been learning.